persistent tiredness symptom, or ME, is wrong purified, lacks adequate financing and is hardly understood by lot in the care occupation, onto an MP who has been campaign in Parliament to changing behaviour. For an emotion Westminster room discussion, Scotch domestic side MP Carol Monaghan reasoned how graduated workout treatment, receive, proposed largest usually on the NHS, is frequently injuring and in requirement of severe review. But researchers over a test of the treatment say it is a secure technique of treat. Guidance on how the disease should be purified in England are now creature enhanced. In the discussion, Ms Monaghan told, characterized as yuppie influenza, and wrong by doctors and political community like, we requirement correctly funded biomedicine study in the causes and treat of such in me less than rather than £1 is consumable every year on every me patient in the UK. Get involves patients making growing amounts of workout above weeks and months, depending on their person as necessary to aid their restoration. But MPs quoted stories of tripartite constituents' affliction in me who say how Get has done their disease worst. Ellie Bunce, 21, was undiagnosed in me in 2016 and it has constrained her to put her sport ambitions on conduct. At the period I was 19, a undergraduate sportsman, in my other year of college, in hopes of boating at international level. I was fitting, busy, I ate so, I carried out. I was lucky and favorable and yet one day I woke sense as if I was moribund. My entire flesh ached in a way I'd never felt up. Ellie says the at first expert she saw offered her way of life was to accuse. He told I should do more than force to wake up at 9 o'clock, get showered, dressed and later go on a length go. That was my treat schedule. Yet, the more than I spurred myself to get out of cot, the more than ill I acquired. Following several months, Ellie was ultimately undiagnosed in me. Day to day each CPI of my flesh is in ache, I fight to recite and concentrated, I'm too weary to go. I expend above of 20 several hours in bed a date. I've been undressed of my hobbies, power and job. I dwell in the expect how one day doctors will discover a treat and how one day I will be superior. The Public Health Guard dog, Pleasant, is now update its guidance for treat in England, but publishing is not due before 2020. At the discussion, permissive Democrat MP Ed Davey named for Get to be hanging up the Pleasant guidance are discussed, increase the opportunity how down there could be next lawsuits of me patients whose state has degraded of the treat. In 2012, the Me Associate carried out a examination of nearly 1,428 patients undiagnosed in the state. It found how of such who were ordered receive, the symptoms of 12% superior, 14% were untouched and 74% incurred worst symptoms. Yet, some public health expert claim how Get is a tested and secure technique of treat. In 2011 a big-scale test, named as the STEP test, Deliberate Treatments Consisting Get and Cognition Behavioral Treatment, CBT. Professor Michael Sharp, one of the research's conduct researchers, told, this test found how Get can be reasonably useful in reduction tiredness and invalidity. We as well found how it didn't reason damage. So the issue is why is down there a conflict among the testing and which human beings are proverb? So it could be since diagnostic is a bit hit and Mississippi, it could be how Get hasn't been made in a cautious path. More than study is necessary to discover out why down there is such a distinction. A Pleasant representative told, we do recognize the debate on the now recommended treatments and will talk in the specialist board, one day equipped, up decisive on any activity preliminary to the complete of the new directive. Down there was an emotion effusion of supporting on public print for the discussion of sufferers, lot of whom sense marginalized and neglected, in no treatment for their disease in view. A chirp of Emma, who told the disease had plundered her of her 20s, was common. Charities as well welcomed the discussion in Parliament and John Siddle of the Me Associate told, we are very thankful to Carol Monaghan for providing the discussion, but in true, the difficult job starts currently. Lot doctors yet don't aware how to detect and supervise me, an absence of study tool how we yet don't include any efficient forms of treat. the is a fully inappropriate position for a illness that affects 250,000 human beings and their families.